Hello, everyone. Welcome to the Technical Committee 21 special session of the Asian Civil Engineering Coordinating Council, hosted by Japan Society of Civil Engineers. My name is Masashi Inoue, a General Secretary of the TC21 Internal Committee in JSCE. Before starting our program, let me give you one announcement for smooth conduct of this session. On this session, only panelists and the presenters can speak. All questions shall be sent through Slido, which is an online Q&A system. So, if you want to raise your question, please access the following URL and input your question. Or you can go to the Slido from the bottom link of Vimeo page.ここからは日本の土木学会の参加者の皆様にご挨拶申し上げます。私、TC21 国内支援委員会、幹事長の井上正史と申します。本日は本セッションにご参加くださり、誠にありがとうございます。開会に先立ちまして、2点ほどご案内申し上げます。このセッションの質問は、オンライン質疑応答システム、スライドにおいて受け付けております。本日のセッション、特にパネルディスカッションにおける質問がございましたら、こちらの URL にアクセスいただき、日本語もしくは英語、どちらでも構いませんので、ご入力いただけますようよろしくお願い申し上げます。また、本日このセッションは ACECC、アジア土木学協会連合会の各メンバー各国にも配信されております。そのため、基本的に英語で進めさせていただきますが、プレゼンテーションには日本語字幕がついているほか、パネルディスカッションも適宜日本語で補足させていただきますので、安心して最後までご参加いただければ幸いです。And now, please welcome the co-chair of TC21, Dr. Mikio Ishiwatari, to deliver welcome remarks.
本日はご参加いただきまして誠にありがとうございます。また日頃より TC21 の活動へのご支援いただきありがとうございます。Thank you very much for joining the webinar today. Also, thank you for your kind support to our activities. The fight against the COVID-19 pandemic is still going on in the world. As you all know, the pandemic is affecting various areas, not only health, but also economy, employment, infrastructure, and all over lives. The reforms must involve not only the health sector, but also a wide range of sectors, including civil engineering and disaster management, as well as from central governments to local communities. This is the concept of Tda Transdisciplinary Approach. It requires collaboration among multiple sectors and multiple stakeholders. Today, 6 panelists will introduce interesting cases, based on which we will discuss the issues. We would appreciate your active participation. 新型コロナ感染症との戦いはまだまだ続いております。皆様ご承知の通り、新型コロナはさまざまな分野に影響を与えております。保険のみならず、土木、防災、経済、雇用、我々すべての生活といっても過言ではございません。その対応は保険セクターのみでなく、土木を含む幅広い分野の政府から地域社会に至るまで、関与が求められております。こうした複数分野、多くの共同が必要というのは TDA、Transdisciplinary Approach の考え方そのものであります。本日は6カ国の事例をご紹介いただき、それに基づき議論を進めてまいりたいと思います。積極的なご参加のほどよろしくお願い申し上げます。本日はご参加いただきましてありがとうございます。
Thank you, Dr. Ishiwatari. Now, we would like to start our session with keynote speech. Hong Congressman Romeo Momo, another co-chair of TC21, was supposed to give a keynote speech But unfortunately, he cannot attend today's session. So Dr. Ishibatari will read his keynote speech instead of him.
Okay. Good day to all of you. Globally, we are in a unique situation in recent history. Most, if not all, countries are battling this pandemic with varying levels of successes. This gargantuan challenge, that is the COVID-19 and its variants, represent another challenging layer as we journey towards building disaster resilience in each of our respective countries. Yet now, more than ever, we need a transdisciplinary approach, not only in combating this pandemic, but in our continued effort to build disaster resilience. In the Philippines, in November 2020, powerful typhoon Goni and Bamko swept across large areas of Luzon, the country's most populous island, leaving millions affected. Earlier in January, the Taru volcano, the country's second most active volcano, located 70 kilometers south of the capital Manila, started spewing lava and sending massive ash clouds and debris as high as 800 meters into the air. The intense seismic activity forced more than 300,000 people to evacuate their homes, while causing severe infrastructure damage. In July 25, 2021, more than 87,000 people were affected by the monsoon rains, which were enhanced by Typhoon Impha, even after it left the Philippines, according to the National Disaster Agency. At least 22,000 individuals are in evacuation shelters. Weather disruptions are also complicating coronavirus containment efforts and vaccination drives. Health officials have asked people to continue to mask up and observe safe distancing measures amid the flooding and evacuations. But it can be readily observed that the social distancing and other minimum public precautions are the least of concerns when evacuees are crammed into makeshift evacuation centers. This quick roundup of the various disasters readily show the enormous challenges each country faces, while at the same time dealing with the current pandemic. While we appreciate that all states and people are placing so many efforts to help and support each other to mitigate the disasters, we must continue orchestrating our efforts more than ever to overcome these global disasters and secure well-being of current and next generations. For its part, the Philippines government has enforced targeted landlocks, unlike before, where entire cities are declared lockdown, provided cash assistance, and allowed construction projects to resume. In addition to limitations by area, the community's quarantines now have different categories, from the most stringent enhanced community quarantine or ECQ to less stringent general community quarantine or GCQ. There are also legislative initiatives to provide for increased hospital bed capacity and staff, incentives to health workers, and additional funding for vaccines. Unfortunately, in spite of these efforts, the Philippines, especially the National Capital Region, is experiencing a recent surge of COVID cases, the first days of up to 22,000 in a single day. In fact, the WHO has just announced that the highly transmittable COVID Delta variant is now the dominant variant in the country. So the road to recovery for my beloved country is still not in sight at this time. Yet I still believe in the resilience of the Filipino people. In our session this afternoon, the estimated discussant being from the countries which have experienced recent major natural disasters are in a position to share their country's DRR activities under pandemic conditions. Transdisciplinary approach has been known as a systematic ways to orchestrate the knowledge and will of different sectors and disciplines to resolve complex problems by developing innovative methodology. Mitigation and response to natural disasters have become more complex than the past due to the pandemic. Under this adverse condition, we are starting to see the transdisciplinary approach is performed in various ways, small or large, in different states to sustain preparedness and response to natural disasters. In this session, we wish to share knowledge and experiences of advancing and sustaining the DRR activities by different sectors and disciplines. Precious experience can be shared by numerous participants and listeners through the online and internet systems, which I'm sure will help accelerate the interaction among experts of multidiscipline and sectors. Safe future lies in the hands of everyone. We must continue to find ways to make us help each other. Before closing, let me cite the comment of Albert Camus' daughter, Kathleen, who says the message of the novel, The Flag, had newfound relevance in that we are now responsible for coronavirus, but we can be responsible in the way we respond to it. It is my hope that in this special session, the knowledge and experiences to be shared by our panelists and the ensuing discussion will constitute our small contribution in addressing the pandemic and represent a move in the right direction towards advancing and sustaining DRR activities under pandemic conditions. Thank you very much. Thank you all very much. Keep safe and move high. By Honorable Romeo S. Momo, Congressman, Republic of the Philippines. Thank you very much.
Thank you very much, Hong Congressman Romeo Momo and Dr. Ishiwatari. Now, let us welcome the first presenter, Dr. Daisuke Sasaki from Tohoku University. Dr. Sasaki introduces TC21 activity so far. So now, please welcome the first presenter, Dr. Daisuke Sasaki.
Good afternoon. My name is Daisuke Sasaki. I'm an assistant professor at the International Research Institute of Disaster Science at Tohoku University. I'm so honored to give a talk on the TC21 activities so far as a member of the TC21 at a special session on the JSTE annual meeting today. As you may already know, ACEC, the Asian Civil Engineering Coordinating Council, was established in 1999. The major objective of this council is to promote collaborative works among international communities towards Sustainable Development Goals, SDGs. There are 27 technical committees at this moment, and we are the TC21, which focuses on a transdisciplinary approach for building societal resilience to disasters. The objective of the TC21 is to promote the transdisciplinary approach for scientific knowledge-based decision-making for building societal resilience to disasters. We propose several approaches to design and practice TDA, for example, discussion and case studies of TDA practices by members of different sectors, conducting comparative analysis, and describing factors and positive effects of TDA, and publication and dissemination. This table shows the TC21 activities so far. I'd like to explain each activity in detail after this slide. In August 2016, the 7th CCAR was held in Hawaii, and the TC21 held a kickoff meeting and the technical session there. The 12 member states Bangladesh, Indonesia, Japan, Korea, Malaysia, Mongolia, Nepal, Pakistan, Philippines, Taiwan, and the USA and Vietnam have joined the TC21. The right photo shows the panel discussion in the TC21 technical session. They are TC21 representatives from Indonesia, Taiwan, and the United States. The TC21 launched the website in October 2016. The TOR member list and all symposium documents are available in the website. The TC21 team visited the Philippines in November 2016 to survey actual disaster damage sites. Our team visited the 3 cities and municipalities in the Lake Island. Ormoc City was damaged by flooding, and the number of deaths and missing accounted for 8,000. We had a meeting with the vice mayor of the city and government officials. We also visited Chaclaban City and Palu municipality, where the coastal areas were devastated by storm surge by Typhoon Haiyan in 2003. In these cities and municipalities, we found good case studies for river maintenance and resettlement planning by stakeholder participation. We also agreed with the leaders of the cities and government officials about how integrated and holistic approaches are essential for recovery from disasters, as well as for preparation for disaster. Our team also carried out site surveys to see the situation such as river improvement projects by resettlement or housings. For example, in Ormoc City, flood mitigation committee consisted of the central government, city government, and barangays. Barangays are the smallest administrative unit in the Philippines, and they are closely connected with communities. Knowledge such as importance and techniques of river maintenance is conveyed to the communities through the committee. In addition, the city government allocated regular annual budget for river maintenance because the decision makers knew how river maintenance was important. We also held a meeting and a symposium in November 2016. The TC21 international members from Vietnam, Indonesia, Nepal, Pakistan, and the Philippines and Japan shared case studies of disaster management in each country through the viewpoint of scientific knowledge-based decision-making schemes for disaster reduction. We also held the International Symposium on Natural Disaster Mitigation at the University of Transport and Communication in Hanoi, Vietnam, in February 2017. We introduced the TC21 and JSC's activities regarding disaster risk reduction. In April 2017, we had a meeting with policymakers in Nepal. We have discussed how scientific knowledge can be applied to decision-making. We conducted a site survey in Nepal in April 2017. As you know, Kathmandu, the capital of Nepal, and surrounding areas were devastated by the earthquake in April 2015, and more than 8,000 people were killed. We have conducted a survey focusing on the root causes of the disaster. We held the second TC21 symposium on scientific knowledge-based decision-making schemes for disaster reduction in April 2017 in Nepal. And we have shared case studies from each member state there. Mr. Momo and Mr. Antonio gave video messages at the JSC Global Leaders Symposium held in May 2017. In September 2017, Dr. Ishwadali introduced a case study in Ormoc, the Philippines, and the TDA at the 7th International Flood Management Meeting held in Leeds, UK. In September 2017, we introduced TC21 activities and case studies in Japan from the viewpoint of TDA at the annual meeting of JSCE held in Fukuoka, Japan. The TC21 held a special session at the World Bonsai Forum held in Sendai, Japan in November 2017. We introduced TDA case studies and measures to remove root causes of disaster. In April 2018, Our members surveyed areas affected by coastal erosion in Nam Dinh Province, Vietnam. We discussed with local government officials in Nam Dinh Province about the recent situation and issues about disaster management. The third TC21 International Symposium on Natural Disaster Risk Reduction was held in Vietnam in April 2018. We held the TC21 session at the Seeker 8 held in Tokyo in April 2019. Another TC21 session was held at the JSC annual meeting in September 2019. The TC21 also held a special session at the Second World Bonsai Forum held in Sendai in November 2019. The aim of the session was to present the needs of TDA for disaster risk reduction and discuss the recent progressing issues. Experts of DRR from Indonesia, Japan, Malaysia, Nepal, and the Philippines presented specific examples to clarify the needs and the merit of the TDA. TC21 webinar entitled Transdisciplinary Approach TDA for Building Societal Resilience to Disasters Under and After COVID-19 was held on October 6, 2020. Case studies from the Philippines and Japan were introduced to show how COVID-19 influences disaster preparedness and response from the viewpoint of TDA. Last but not least, I'd like to introduce a book entitled Transdisciplinary Approach TDA for Building Societal Resilience to Disasters, Concepts and Case Study for Practicing TDA. This book was published by the TC21 in September 2019. It not only describes the concepts and potential power of TDA, but it also discusses the key components and structure of TDA models that were assessed through the case studies performed by the TC21. The contents are intended to clarify the necessity of TDA and catalyze innovative approaches to implement scientific knowledge-based decision-making by TDA for disaster risk reduction. Thank you very much for your kind attention.
Thank you, Dr. Sasaki. Our next presenter is Dr. Masaru Arakida from Asian Disaster Reduction Center. Dr. Arakida will introduce overview of pandemic response of Asian countries. Please welcome the next presenter, Dr. Masaru Arakida.
Hello, my name is Arakida Masaru, Research Director of ADRC. Today, I briefly introduce evolving disaster response measures during the COVID-19 in Asian countries. Today's topics are Introduction and Disaster Response Challenges during a Pandemic and Evolving Disaster Response Practices during a Pandemic. Introduction. About ADRC, according to the Yokohama Strategy in 1994, ADRC was established in Kobe in 1998 with a mission of enhancing the disaster resilience of its member countries, building safe communities, and creating a society where sustainable development is attainable. ADRC works to build disaster-resilient communities and to establish networks among countries through personal exchange and a variety of other programs. Asia, with its large population, is said to have the highest number of COVID-19 infections and deaths. However, when comparing the number of infections and deaths per million people with other regions, it's clear that the numbers remain lower than the global average. Recent experiences indicate that the disaster risk management agencies in many Asian countries are expected to face unprecedented challenges in dealing with concurrent crises or disaster on top of the COVID-19 pandemic. ADRC's first online Asian Conference on Disaster Reduction, ACDR 2020, was held from 20 to 22 October 2020. The conference is an annual meeting of ADRC member countries and relevant organizations to share advanced information and approaches on disaster risk reduction in Asia and to strengthen the ADRC network for the implementation of Sendai Framework for Disaster Risk Reduction and the Sustainable Development Goals. How would disaster risk reduction agencies prepare for and respond to a disaster under the COVID-19 pandemic? ACDR shares experiences from government officials and experts, including those from countries affected by pandemic disasters. Disaster response challenges during a pandemic. Multiple disaster events could occur simultaneously in one location. If the disaster response system is ill-prepared, it could result in wide-ranging impacts and greater loss of lives and properties. One example of this is the Great East Japan earthquake of 2011, where the magnitude 9.0 earthquake caused high tsunami waves of up to 38-meter high that subsequently triggered a nuclear power plant failure. Some experts describe such events as cascading disasters, which progress from one disaster event to a range of interconnected events, causing wider impacts with devastating consequences. In the context of the COVID-19 pandemic, the issue of cascading composing disaster is again highlighted in learning events to further inform disaster response policies and action. Since the COVID-19 pandemic is dynamic and prolonged crisis, it could certainly intersect with disasters caused by natural hazards. When this happens, it will be a case of cascading compounding disaster. Recently, some experts also refer to this as concurrent crisis, where a disaster that is triggered by natural hazards overlaps with a pandemic that is triggered by a biological hazard. Although the concept of concurrent crisis shares similar meaning with both cascading disaster and compounding disaster, this presentation adapts the term concurrent crisis to put emphasis on the experience of disaster response systems such as response system for disaster caused by natural hazards and response system for crisis caused by biological hazards. In case of the GEJE Japan faced triple disaster, earthquake, tsunami, and nuclear power plant failure. And Korea had a simultaneous disaster such as typhoons and heat waves plus COVID-19. Coordinating parallel response systems. In most countries, the pandemic health emergency response system is separate from the disaster response system. The health agency leads the COVID-19 response, while the DRM agency leads the disaster response. These parallel response systems create administrative bottlenecks, including issues concerning leadership, mandates, and coordination. For instance, the DRM agency is likely to experience coordination issues in screening and isolating COVID-19 infected individuals at the evacuation centers, if testing and information about quarantined and suspected individuals are under the mandate of the health agency. Having separate response system for health emergency and for disaster emergency is a common practice in governments that distinguish between biological hazards and natural hazards. Distinguishing biological hazards from natural hazards influence the type of intra-governmental coordination. These are three types of intra-governmental coordination in responding to COVID-19. One, the state directly heading an inter-agency task force. For example, leadership by a president or a prime minister or another direct line of leadership. Two, the Ministry of Health leading or coordinating the response. Three, the DRM agency leading or coordinating the response. In case of a pandemic, the single hazard disaster response system needs to put in place additional measures of mechanisms so that they could continue to operate even in the midst of movement restriction, social distancing, and face mask mandates to prevent the spread of infection in disaster-impacted areas. When these limitations are revealed during the actual response activities, the DRM agency needs to immediately adapt its response system to address the challenges. This means that the DRM agency must update its standard operation procedures, protocols, and guidelines for disaster response. Evolving disaster response practices during a pandemic. Adaptation of response system entails that early warning may now integrate information about clusters, hotspots, outbreaks, and location of COVID-19 infected individuals. Emergency stockpiles may now include face masks, disinfectants, testing kits, some meters, personal protective equipment, and vaccines. Disaster evacuation procedures may now include testing, screening, evacuees, isolation facilities for infected evacuees, and social distancing measures. Disaster responders may now require basic knowledge about COVID-19 as well as wear PPE to prevent the spread of infection in disaster-impacted areas. In India, NDMA developed a GIS-based decision support system platform to manage disaster in the midst of the COVID-19 pandemic. This platform has a geo-enabled dashboard for the public, where state disaster management agencies and other stakeholders can access information related to COVID-19 cases, logistics, resources of surveillance. It has real-time analysis report of COVID-19 case history and geotagged information about treatment facilities, food, and shelters. GeoSyncs a Taiwanese company working with ADRC has already developed an interactive disaster management application called Jiobin-An. Using this, they have developed a system to share the status of incoming masks in Taiwan to contribute to citizen safety. MobiPack, developed by University of Tokyo, is used in some countries as a decision support system tool for managing COVID-19 as well as other disasters. MobiPack utilizes detailed record data of all mobile phone subscribers to track and map their movement behavior. It shows near real-time movement of people that can be visualized in dashboards and screen monitors. It is useful in responding to disaster during a pandemic as it can show the hotspot, clusters, and whether people are following the movement restrictions imposed by governments to prevent the spread of COVID-19. Philippines was struck by Typhoon Ambo in May 2020. OECD introduced new practices in disaster response, such as suspected COVID-19 cases were segregated from the evacuation area. Separate facilities were designated to take care of suspected COVID-19 cases. Occupants of the evacuation room must be either members of the one family or people who know each other from the same neighborhood, and no media is allowed at the Emergency Operations Center. In Japan, guidelines were developed on how to segregate lines, ensure disaster between individuals, and secure additional shelters to reduce evacuation density. This has resulted in shelters accommodating on half of the original capacity in the event of actual disaster. It was also necessary to secure isolation facilities for infected people and to stockpile additional supplies such as face masks, disinfectants, and thermometers. Ministry of Administration and Security was able to control the spread of COVID-19 in areas affected by heat waves, heavy rains, and typhoons in the summer of 2020. On 16 June 2020, MOIS issued a new guideline on temporary shelter to prevent the spread of COVID-19. The guidelines are based on the set of principles. The guideline outline quarantine measures before operation of the facility and the stockpiling of sanitary supplies. The implementation of the guidelines during the summer disaster prevented the spread of COVID-19. This presentation presented example of how DRR agencies which had been responding to the expected scale of disasters have started to respond to different multiple disasters and infectious disasters as a result of COVID-19. I hope that the sharing of new knowledge will help to build a safer society. Thank you very much.
Thank you, Dr. Arakida. Our next presenter is Dr. Youb Raj PAUDYAL from National Reconstruction Authority of Nepal. He will talk about school reconstruction and the COVID situation. So please welcome the next presenter, Dr. PAUDYAL.
Thank you so much. Namaste everyone. I'm Youb Raj PAUDYAL, Deputy Project Director, National Reconstruction Authority, Government of Nepal. Today I will be presenting on application of Project Monitoring Information System for the robust monitoring of the school reconstruction program in Nepal during COVID-19 pandemic. 2015 Gorkha earthquake devastated around 9,552 schools, and total losses is about $1,806 million in education sector. Based on the assessment, around 7,553 schools are to be reconstructed. Up to now, we have completed 6,647 schools. So it comes around 88% of the total target. Now, we have around 1,000 schools are ongoing in reconstructions. However, in between, we faced a lot of problem from the COVID-19 pandemic, and for 1.5 years. So government announced the fully lockdown, and there is a travel restrictions for the workforce and the engineers and the transportation of the materials as well. As we know, Nepal has a diverse geography and a difficult terrain. We have the schools in scattered locations in the earthquake affected districts. There is a challenge in monitoring of the progress and quality of construction and the tracking of the workforce and materials as well. And there is also the challenge in the monitoring of the build back better features in the buildings as well. However, we know that many of the students are out of the classrooms. We need to enroll them inside the classroom as soon as possible. Therefore, we have the urgency of timely construction of the project on time. We have the many resident engineer, quality control experts, and many experts working in the field level as well. However, they are facing many difficulties to attend the site physically. We have the very poor internet accessibility as well because of the geography and the difficult terrain. Yes, there is an impact from the COVID-19, and that's why we have the slow in the progress and the difficulties in physical monitoring of the and quality control mechanisms. And many engineers and the workers affected by the COVID, and many community people as well. Therefore, the peoples are fear among the staffs and the workers as well. And some project costs also demanded the additional cost for this COVID pandemic as well. However, we have government maintain the standard operating procedures and implement the health and safety protocols at all levels, means from the headquarters to the community level as well. So government also issued the passes to transport the materials and the workforce from one place to another place as well. We use the virtual platform for project monitoring and also progress tracking. And we set up the virtual desks in each and every systems so that we can monitor virtually what is going on at the construction sites as well. And one important thing, we developed the project monitoring information system, that means the PMIS, for assessing and the disseminations of the information from central level to the community level, that means the site level, and site level to the headquarters. The application of the PMIS, we can see in the slides, it's really for the real-time progress monitoring, workforce tracking, and the quality control tracking during the COVID-19 pandemic. So this is the application. And how it works is the cloud-based software. So, and we develop these applications. We install in the tablets, and we distribute it to the site engineers. From the sites, they collect all the informations of the progress and the different ongoing program in the site level. And they upload it in the application through the tablets. And then the people who are living at the headquarters, they monitor from this application. And some informations, they will share from the central level to the site level as well. So it is offline to online and also online to offline as well. So it's the both way it works. And the workflow is the data flow. the system works from top down and the bottom up approach, and to collect the field level real-time progress and issues as well. We have the 3 offices, actually the 3 units at the central level, at headquarter level, led by the project manager and team leader. At the district level, we have the resident engineer, and at the site level, we have the site engineer as well. So the information from the headquarter, from TL office to the site offices, it flow accordingly, and also the information from the site offices to the headquarter, it uploaded in the tablets and through this application, and collect the information and control all those information and progress from the central level as well. It has 3 objectives. One is the real-time interaction of the monitoring desk with the field level. That means all the information of the materials and the manpowers we track from the central level, and also the progress based on the plan versus progress also can be tracked through the systems. And third, very important one, is the quality control. They upload the pictures and also the different the information from the side level. The quality control experts in the headquarter level, they monitor through this application. So it has a different features. You can see in the slide the geographical database. It's an application, and also we can track the delay in the information sharing as well. So it has a different features we can see in the slide as well. It also updates us the delay in the progress reporting from the field level. If it is generated auto alert of the sites whose progress is not reported since more than 15 days. So if any site engineer didn't or does not inform to the headquarter, and after 15 days, it automatically shows the alert to every expert. So that the site engineer, he need to inform to us if there is a delay from the site information as well. And it also shows the email alert if there is any questions from the site engineer, and the resident engineer from the district level, if he inform to the site engineer, and also there is an issue in the quality of the site, and those information reach to all the experts who are living the central level as well. So all the people know about the real issue of the site as well. And also it track the workforce working in the site level, tracking required. That means how much we require in every day, and what is the actual presence of the workforce at every site. So we can see some example here as well in the different construction sites in the slides as well. So we can monitor the required versus actual of the workforces as well. It also gives us the time series of construction activities from the foundation level to the completion of the project. So the site engineer, they uploaded the data, that may be even the pictures as well, from the foundation level and the brickwork and everything in the PCC, RCC, and reinforcement, and up to the finishing level. So everything we can track from the central level, and we can sometimes report to the higher authority as well for this system. And it also generates the S-curve so that we can easily monitor the plan versus progress of the project as well in every sites of the school reconstruction area. And one important application for the quality control mechanisms, if there is a case, for example, in here we can see that the reinforcement is not properly laying and also not connected with the foundations. So the site engineer upload those in the pictures, and then the quality control engineer, they saw this kind of the information through this picture, and they alert to the site engineer that is wrong, that's not properly connected with the foundation. So this alert information reach to all the team leader and project manager as well. And later on, they instruct to the RE, resident engineer and quality control experts, instruct to the site engineer about how to fix these problems. For example, here, they saw the laying on the reinforcement is not good, and also foundation is not properly connected with the reinforcement. So they instruct to have the pocket beam in the foundation. So they instructed to the site engineer, instructed to the contractor. Accordingly, they construct this pocket beam. They connect this reinforcement with the foundations, and then easily it ratified through the support of the experts to the site engineer. So ultimately, this quality control, the solve and is closed by the quality control experts. So this is very much useful for the quality control mechanism. Even the quality control engineer were not present in the site physically. So in conclusions, the COVID is a new case for Nepal, even for the world. Many factors are still unknown. Preparedness and response from the government were not adequate in the beginning, but increased capacity at the later stage. Implementation of the standard operating procedure and site level preparedness and response is challenging due to the low level of awareness and internalization of the risks. Inter-agency coordination plays a very important role. We coordinate very well with the community and local authority and the districts and the central level as well. And use of the web-based technologies such as project monitoring information system is found very effective. It helps in progress monitoring, resource tracking, and quality control in reconstruction, and sharing the information from central to the local level and local level to the central level as well. This all my presentation. Thank you. Thank you so much for listening. Thank you.
Thank you, Dr. Pojal. Our next presenter is Dr. Khamarrul Azahari Razak from University Technology Malaysia. He will talk about compound disaster of flood and COVID-19. So please welcome the next presenter, Dr. Razak.
Hello everyone, greetings from Kuala Lumpur. It is my great honor to be here virtually to present you some case study from Malaysia. Thanks to ASEC TC21 and JSCE for the opportunity given in this special session. My name is Khamarrul Azahari Razak from Disaster Preparedness and Prevention Center of Malaysia, Japan, International Institute of Technology, University of Technology Malaysia. Today, I will be presenting a talk entitled Advancing Compound Disaster Risk and Societal Resilience in Malaysia, Progress and Challenge. Here are the content of my talk, Disaster Risk Before COVID-19 Pandemic, and also current scenarios, situations of COVID-19 pandemic in Malaysia. Within TDA spirits, I will be sharing some progress and challenges for compound disaster risk based on rapid assessment and field observation during last monsoon, and concluding my remarks with few recommendations. Let's have a look some fact and figure about disaster risk in Malaysia before COVID-19. ASEAN Report 2019 stated about 67% population in Malaysia exposed to flood based on data collected from 2012. And Malaysia is also expected to increase its urbanization rate up to 85% by 2040. With 32% rainfall increment based on the future climate scenario in some states prone to floods. In October 2019, National Disaster Management Agency NADMA has released stated about 424% economic losses based on data compiled in the period of 2009-2018 for Sendai Framework Monitor reports. Let's have a look COVID-19 pandemic in Malaysia. From 22 cases in the first wave of outbreak in January 2020 to 6,000 cases by April last year in the second wave of outbreak. And the third wave was reported about 15,000 cases in October 2020 and dramatically increased up to 70,000 people by December 2020. It is also worth to mention that the movement's control order or lockdown has cost us about 2.4 billion losses per day, and the trends are increasing with new variants. More people are easily got affected thanks to the national vaccination program, one of the fastest vaccination rate in the world. In this talk, I would like to highlight the field observation during monsoon season. So far, about 1.2 million people got affected, with 20,000 daily new positive cases, with about more than 10,000 total death. Definitely, there are many lessons learned. Being one of the best countries handling pandemic, as demonstrated last year, to one of the highest daily new positive cases globally, as shown this year, and in fact worse in Southeast Asia region at the moment. And interestingly to note how actually the transdisciplinary approach helps to strengthen the risk governance and societal resilience. In this slide, I would like to highlight 8 key elements for Tda implementation, especially the aspect of whether scientific knowledge is tested in the field or reflected in the policy. It is also good to reflect the cycle of knowledge flow in terms of tacit, explicit, and new knowledge for supporting Tda. Here are the links for further readings. During last monsoon, we went to the field, traveled about 1,500 kilometers by roads to observe and rapidly assess the compound disaster risk. We had technical visit to riverine flood-prone area and engaged with state and district disaster command center. In this trip, we focus on disaster preparedness, how actually the early warning data information disseminated locally, early evacuation and resilience. In last northeast monsoon, about 320 floods were recorded based on the media release by the Ministry of Environment and Water on 12th of January 2021. NADMA Malaysia has reported about 125,000 people displaced from their home, the number even larger with victims who are not registered in the gazetted evacuation center. It is also worth to mention that zero virus transmission in more than 1,000 temporary evacuation center. Remarkable achievements indeed. One of the success story is this guideline for disaster management COVID-19 released by NADMA in October 2020. It was locally accepted and easily implemented at the local level, of course with the great support of various parties, public, private, academia and NGOs. This is also another example, unique example. We had a community-based disaster risk reduction program in Redang Island right after the monsoon end during the COVID-19 pandemic. It was done upon the King order to strengthen local community to fight against COVID-19. In this program, we appointed 10 local champions, enhanced local risk communication, renewed an evacuation plan, and co-designed the local DRR and resilience strategies. Of course, the concept of Tda has translated practically at the local level with the use of science and technology to build societal resilience. Next, I want to share some progress and challenges for compound disaster risk and resilience. First, risk assessment and management. Second, on governance and communication. And the third one on risk developments and investment. Firstly, risk assessment and management. We highlighted the challenges in the risk statements. There is a significant evidence in the use of science and technology to map, model, and assess compound risks, especially related to floods and COVID-19 pandemic. However, the data integration, geo-visualization, and big data remain the challenges. Secondly, early action and evacuation remain the gaps in implementing an impact-based early warning system beside the issues of localization and detailed impact analysis. Third, the unstructured process of utilizing the indigenous knowledge for rapid assessment and integrating them into the system are quite challenging. Second, risk governance and communication. We observe the roles and responsibility by the Secretary of Disaster Management Committee and local governments are very significant. However, limited resources and shared responsibility of others stakeholders should be strengthened. Second, managing climate-induced disaster and COVID-19 is about balancing life and livelihood. With respect to compound risks, we need a strong leadership, clear line of command, and social trust as an important ingredient to good risk governance. Lastly, we have seen the use of digital platform and tool for public warning, but still rural community prefer a traditional way to disseminate the early warning information. Once again, empowering community-led action and localization remain the major challenges. Last but not least, risk development and investment. Despite some positive progress in mainstreaming DRR into development planning and DRR investment, some aspects are critically needed to address, such as comprehensive cost-benefit analysis, to say, for example, a scientific-based enforcement, political will, and sufficient budget. Secondly, protecting risk-sensitive environmental area and critical infrastructure. Some challenges like updating data, quickly carry out damage assessment, and making our infrastructure more resilient. Lastly, there is a urgent needs to advance our digital transformation, technology infrastructure towards promoting risk-informed sustainable developments. As a conclusions, I've shared some progress and challenges based on field observation with significant input from many agencies and stakeholders. Managing compound disaster risk is complex, even so with pandemic situation. I wish the TDA concept has been translated into the technological solutions or assessment tool like situational awareness and promoting pandemic risk reduction for resilience. Secondly, crises always come with great opportunity. We must strongly promote TDA culture for building resilience to the lawmakers, disaster managers, government system, and the people. Even so, during the COVID-19 recovery process and support their build back better. Lastly, TDA must be translated, locally adapted, and practically implemented. Of course, we must inject this TDA culture into this multi-tier decision-making process. And on my last note for today's presentation, evidence for TDA localizations are critically needed. With that, thank you very much. Stay safe and healthy. Bye-bye.
Thank you very much, Dr. Razak. Our next presenter is Mr. Ting-Chi from Sinotech Engineering Consultants, Taiwan. He will give us a presentation about disaster management and evacuation management in COVID-19 situation in Taiwan. So please welcome the next presenter, Mr. Sao.
Ladies and gentlemen, it is my great honor to share our experience in Taiwan of disaster management and evacuation under COVID-19. I am Ting-Chi Cao. I'm from Sinotech Engineering, Taiwan. Sinotech has been established for more than 50 years. Our research facility and our engineering consultants company, together we have nearly 2,000 experienced scientists and engineers. In the past 50 years, we have overseen a lot of important infrastructures in Taiwan. This is the outline of my speech today. Taiwan is located in the Western Pacific. We are frequently visited by typhoon. So since last year, when COVID-19 started, we're dealing with a serious problem in disaster management. Until early August, in Taiwan, we have more than 15,000 COVID-19 cases, and that resulted in nearly 800 deaths. And in Japan, at the meantime, we have nearly 1 million cases. Most of the cases were concentrated in metropolitan Taipei, as you can see in this figure. However, in Taiwan, before May this year, the cases were very few, and only in mid-May, the cases started to rise dramatically. And also, the May is the beginning of the flood season in Taiwan. So the typhoon issue is combined with COVID-19 since May. We take a further look at what happened since May. From mid-May to mid-June, there were hundreds of cases daily. So in May 19, the Level 3 alert was issued nationwide. The Level 3 alert means, first, all schools were closed. Work as usual, but follow instructions. Wear medical masks at all times. Public facilities like library, museum, movie theaters were closed. When indoor, make sure there were less than 5 people gathering. And outdoors should be less than 10. Restaurants were restricted for takeout only. Avoid unnecessary travels. It is how it looked like after the Level 3 alert. The movie theaters become like this in the weekend. Metro Taipei was so crowded, but it is how it looked like after Level 3 alert. Also, the night markets, people were gone. So there were new normals in Taiwan under COVID-19. First, observe social distance. Indoor greater than 1.5 meters, outdoor or 1 meter, and use plastic shields. For personal sanitation, wear medical masks at all times. Wash out your hands and measure temperature regularly. Use contact-based registration system like QR code or paper-based. Here are some shots for the Emergency Operations Center in national level, county level, and township level. As you can see, social distance were observed and plastic shields were applied. All people wear medical masks at all times. We also set up off-site backup commanding center, as the example here by Soil and Water Conservation Bureau. They set up first and second operation center offices, and the command, communicate, and decision-making were made online. In the mountains, at the entrance of the tribe, posts were set up. Visitors were required to clean their hands and scan the QR code system before they enter the tribe. Then at the field, remember that at outdoors should be less than 10 people, so 1, 2, 3, 4, 5, 6. Outdoor social distance should be greater than 1 meter. Wear medical mask at all times and clean the hands with 75% alcohol. At the construction sites, temperature were measured at all times for visitors and daily workers. Some entrances were blocked, and QR code system was set up at the entrance of the construction site. At the indoor office, plastic shields were applied. For the evacuation and shelter management under COVID-19, we followed the instructions by the commanding centers issued in May and April last year, but only until this year, all these were actually put to practice when typhoon visited us. For the evacuation plannings, the first of all is to make sure everyone wear their masks and wash their hands and their temperature measured regularly. For these quarantines, they have to be registered. And for the transportation, special concerns should be made for those quarantine personnel. They should not be mixed with regular evacuees. These are some shots at the Typhoon Infa in July when local residents were evacuated. You can see that people wear medical masks at all times. And for shelter planning and management, for home quarantines, people were moved to special quarantine facilities or hotels. For those regular evacuees, they were sent to hotels or hostels or other shelters. The important thing is to secure proper distance, no matter indoor, outdoor, or during dining. Here are some examples for the management of the shelters. At the entrance, the plastic shields were applied, and people have to wear medical masks at all times. In the living quarters, the extra social distance were observed. You may see that during my previous slides, the QR code were shown, and I will take a little bit introduction about this. This system was only introduced in May 2021. At the left-hand side, you can see the paper-based old-fashioned way and the new QR code system at the right-hand side. The system was developed by Audrey Tan. My friends in Japan told me that he's very famous in Japan. The system only needs 3 steps and could be finished in 5 seconds. It is contact-free and the SMS message is also free. The QR code is applied everywhere at the entrance of supermarket, high-speed rail station, 7-Elevens, restaurants, and even at the park. Here is the case on the bus. The QR code were posted at the window, at the back of the seat. Basically, you scan, you send the SMS message, and it contains time, location, and phone number. So here is the ID of the facility, the bus plate, and the instruction of the operation. Here are some photos I took, how people scan the system. It only took a few seconds. It is at the Taipei train station entrance and the high-speed rail station. People just scan it and you can enter. Conclusion: COVID-19 affected Taiwan dearly since this May. New normal includes regulations and instructions were applied in daily life and also in disaster management. More pre-planning and management efforts considering COVID-19 for evacuation and shelters were required. New but simple IT tech, the QR code scan system, were introduced to monitor the flow of the crowds. And these are my speech and our experience in Taiwan. Thank you very much.
Thank you, Mr. Sao. Our next presenter is Dr. Chandan Ghosh from National Institute of Disaster Management, India. He will talk about COVID-19 second wave in India. Please welcome the next presenter, Dr. Ghosh.
Namaste, I'm Chandan Ghosh from India. My topic is COVID second wave in India, oxygen crisis, mass congregation, statistical fallacy, and vaccination conundrum. First thing is that oxygen crisis that which came up, and then how India government took up by mass scale transportation of the oxygen train, express train across the country, even though it started a little bit late, but it could take up the situation under control. Not only that, train moved with industrial oxygen turning to the hospital, which was in high demand, but also many of the train compartment converted to COVID hospital overnight. So the context of my presentation is in the medical profession and the sources of disease and deaths other than COVID or vector-borne diseases. I'm going to give some aspects on that. Then it has changed dramatically our lives, business, real estate, tourism industry and everything. And of course, construction scenario also across the globe. So from what we have learned from the mandatory mask wearing to safe distancing, testing, tracing, and isolating cases so as to outlast the virus. But now, even after several courses of vaccine and drugs, we are lingering on of the variants or Delta variants that which is known and ravaging many of the countries even now. So we are completely taken aback with an awe, worry, and colossal loss that ever have affected the mankind. As far as India government's efforts is concerned, most of the database are created in the My Government website, and all these are daily and hourly basis. Many organizations in the country and abroad are being shared about this database, and I would say that that while whichever data, whether it is state-wise, language-wise, you see in Hindi, Bangla, and Marathi, and Gujarati, all these languages also being disseminated all this information through Government of India web portal, My Government web portal. So as of now, we have whatever death cases are minimal, less than 1.3% or so. And vaccination doses taking place almost highest is about 1 million doses per day. Another aspect is about the mass congregation that took place before second wave started in March, April. And what is the impact of that? And also there are some assembly election took place in some of the states, but death rates are minimal and positivity rates are also minimal, which you can see over here. Compared to USA, it is 1/16 in India. Despite just going beyond that, whatever COVID has been affecting, that if we go WHO data, that which according to 2020 report, there are more than 160 diseases for which trends, analysis, and their projections are being disseminated and known in the last 2 decades only. So we have to think something else other than COVID also. As far as taking that comparison of low versus high income group, that what are the leading causes of death? So 10 such lists have been made over here for the high income group, where you see heart disease scoring number one, diabetes is number 10, but in low income group, and much less, even though neonatal conditions are there. And so malaria and other than stroke, these are all taking some places in case of low income group. India, of course, in between. But when we look at from this normal death cases, if I take the city of Mumbai, that where each of these age are dotting the number of hospitals with lots of facilities. You know, Mumbai is our economic capital, having so many hospitals dotted here nearby. Why second wave became more virulent than first one in India or even in other cases is in fact with so much of database that we are having, they cannot explain. Is there projections for third or fourth wave, which I'm going to show that what are the projections being made by statisticians, whether it is to be taken as a fallacy as on date or it is again a confusion that I'll show. Health system, wellness, immunity perceptions, drugs, where is the key for survival? Even detecting so many things, still we are not convinced enough that how we are going to survive. And then what is the scope for more health workers and more congruent planning? Of course, we are doing a lot of such planning and guidelines are being disseminated. shortage of oxygen and essential drugs, production, supply, delivery, awareness campaign. You know, we are a diverse country, it is a continent itself, that how effectively these are being distributed throughout the country with different languages and culture, that is really exceptional. Then vaccination production, that which our country also has been producing, and acceptance criteria, and also delivery gap, which is always there, but we have been able to make it much more comprehensive now enough using digital media and widespread communication network that we have established. As far as outcome of total closed cases, which is significantly high closed cases are there, and India fared better in terms of death rate and also recovery rate. Right now, western part and southwestern part is surging with COVID for more than a month, and but the cases are less than 40,000 a day. And also, whatever is the current status where India is standing, it is just 30,000, 40,000 cases compared to that some other countries, UK, France, that which is rising. But what is projected by our famous modeler from two of the famous institutes are there, that till by mid of October, maybe it is going to have a peak based on what we have faced in the month of April, May, which is here around 0.4 million, but which they are saying that right now we are in this phase, so it may be 1/4 of that, it not be more. So we are going to see it within a month or two. So India has around 31.1 million cases and with 0.43 million deaths officially. Of course, unofficially, people say made that it may be even 5 times to 10 times more, but you know, it is so difficult to count all those cases. But overall, cases are less than 1.3%. So we have been running with regional lockdowns, reduced social interactions, and increasing number of antibody tests going on. It is helping to bring down the infection rate. Of course, vaccination drive that which is going on, almost 1 million doses a day, which has covered almost 45% of the total population by now. And still it is going on till at least we can cover 80% of the population. And serum survey shows that almost 2/3 of our population got the antibodies against COVID. But some of the things that pandemic aspect things that even like in this case, CDC study shows that 74% of the people infected in USA, that in one place, Massachusetts, COVID outbreak were fully vaccinated. 74% of that who were fully vaccinated, they got infected. So there are many such things are coming up, which are really intriguing and sometimes confusing also. But it is true. And moreover, whether it is to be we are going for second shot or third shot or not, even Thailand or Israel and many other countries, they are going for even booster doses also. But still, we are not sure that what actions to be taken or what is going to work. So there are many unassuming apprehensions and maddening world that we are dealing with. So global issue, of course, currently just over 1 billion people around the world are fully vaccinated against COVID, but some of the countries that we neither produce nor do they have any economic status to buy, then they are facing a lot of trouble, and which we have to worry about that. Then a truly global vaccination effort is the current strategy that so that we can reduce the chances of global spread of resistant strain, and which is again shrouded with questions. Ultimately, those which are going to escape the strain, vaccine-escape strain is still in the domain of research, that what is going to be those who are escaping the strain. So before thanking you, I would say that we are making a revolutionary progress with the country's omnious gift, that it is whatever is known from India throughout the world. More than 100 countries are using. So we are using our labor forces over here to change this erosion control and landslide controls to this greenery, to give a sustainable world that which we are worried about for the next 20, 30 years with the IPCC report that which came in. Thank you very much. Namaste.
Thank you, Dr. Ghosh. Our final presenter of today's session is Mr. Warren Ladbrook, a technical director from Auxilium Limited Company, New Zealand. He will give us a presentation about COVID-19 situation in New Zealand. Please welcome today's final presenter, Mr. Ladbrook.
Good day. Welcome to the session. My name is Warren Ladbrook, and I'm pleased to share a perspective from New Zealand. So welcome from my country. This special session is a great opportunity for us to come together from around the world, and certainly hope that this is of interest. My overview today is not going to bombard you with lots and lots of slides. Rather, there'll be a few slides that I want to make some points about, and hopefully you will find interesting. Obviously, we'll talk about the impact of COVID in New Zealand. We'll talk a bit about the government response and the public response, and also some closing comments about the industry response. I would like to identify that the countries that you see compared below, Japan, Australia, and New Zealand, are very interesting comparisons when you consider the density of the populations and how urban they are. It's very clear that there's a lot more urban land in Japan than there is in New Zealand, but New Zealand actually has a higher percentage of our population living in those urban centres. And also, if you look at the non-urban areas, you'll see that Australia is a lot lower than either of the others, and New Zealand's also very sparsely populated as well. So with respect to what does COVID look like in New Zealand, on the top graph there, you'll see the curve, and this is showing the daily cases since the first case that we had, which was on the 28th of February last year. Borders were closed on the 19th of March, and you'll see those dashed lines. Those are reflecting the different lockdowns that we've had over the time since then. This is showing actually relatively low numbers. The inset graph down the bottom there, you'll see the red is the New Zealand numbers, and as comparison, the blue numbers are those from Japan. Recognizing that Japan is 25 times more populated than New Zealand, we would expect to see much higher numbers. But we have been quite fortunate in New Zealand that we are an island nation and have been able to control the travel to and fro, which has been very, very good. Would note that we have had 26 deaths, which is unfortunate, and that is relatively low percentage. And most of those have been elderly people. There's 3 people in their 50s, 3 people in their 60s, 7 in their 70s, 8 in their 80s, and 5 people in their 90s. The biggest impact, obviously, is on the families who have had loved ones pass away. But we have had in New Zealand nearly 3,000 total cases since this started. Of those, there's nearly 5%, or 140 of them, have been in hospital. And presently, we do have 69 active cases within New Zealand. That did jump just in the last couple of days. We were at about 30, I think, but we've had a recent emergence of Delta variants. Biggest impact, though, is that tourism has stopped. You'll see in this graph in the lower right, we've had very cyclical, seasonal type, and has been increasing for quite some time, tourism to New Zealand. It's a very beautiful country, as you can imagine, and hopefully some of you have had a chance to visit. But with the borders closing, tourism stopped, and that was a very, very significant impact on a lot of our industry and businesses within New Zealand. If you do have a close look, you'll see a small uptick in that graph, and that's showing where we've had limited Australian visitors in 2021. That has stopped with the most recent lockdowns that we have. This smaller graph on the left is showing the job seeker beneficiaries and income support recipients. We don't have exact numbers on businesses. Obviously, a lot of them are private, but what we do see is that with the onset of the pandemic, a lot of people did lose their jobs, which is very unfortunate. And so you'll see this rapid increase in people looking on a benefit. you may be able to tell those green bars, that's where the government stepped in and provided support to businesses to keep people employed. And that was very, very well received. There has been a steady decline in the number of people receiving a benefit to present day. Hopefully this current lockdown we're in is short and does not materially affect those numbers. But it does show that the businesses have been affected, but have been gradually looking at adapting and improving their situation. There is an indirect impact in New Zealand that's been exacerbated by this, and that is the housing crisis. A lot of people may think New Zealand's a lovely place to visit, and it is, but it's quite an unaffordable place to live. If you look at this graph, the bottom line is the wage increases over the last 20 years or so. The line slightly above it is the rent increases, which is slightly higher. But this top line is showing the house prices over that time. With the Labour governments in red and the national government in blue, what we see is that house prices have continued to climb, irrespective of who's in power. And this is for a variety of reasons, primarily the long time to get houses approved for construction and that process. Material costs, interest rates being low that's driving a lot of demand, and a reduced housing stock, which is because of a lot of people aren't wanting to sell when buying a new house is quite expensive. So what has the government done? Well, with respect to COVID, they've shut the borders down, as I mentioned. There's been numerous lockdowns, as I've also mentioned. And I did allude to the fact there's been financial subsidies to businesses, as well as subsidies and support to individuals as well. One of the most important ones I wanted to mention, though, is free training programs. So they recognize a lot of people can't do work like they used to. A lot of people in the tourism sector, for example. And so they're looking at retraining people into primarily the trades. And this is to address the infrastructure and housing problem. So there's been a lot of predominantly young people, but older ones as well, who've taken up those opportunities. They have introduced a tracer app on people's phones, which is a good way of trying to keep track and contact tracing when there's been an outbreak. Obviously, with the borders closing, we've got a managed isolation and quarantine process, and more recently been rolling out the vaccination program as well. So in terms of the public response, it's actually been very favorable. If you see New Zealand if you look at this graph on the right-hand side, New Zealand's down here with very, very good approval ratings. And most people have been very compliant with the lockdowns. It's a lot easier when the lockdowns have been relatively short. I'm not sure if it'd be the same way if they had been extended. People, individuals and businesses have been very appreciative of the economic support. But I will say that individuals have been relatively complacent with the use of their tracer apps. As I imagine most people are familiar, there's a lot of apprehension about this. And so that can be seen in spending. So this graph here in the middle is showing credit card spending here in New Zealand in different regions. And you'll see it's dropped significantly, including these blue spikes when there's been some lockdowns in Auckland, where people weren't going out and spending money. Has been a general decline in that spending with kind of really in 2021, there has been an increase as confidence has been resuming. With the current lockdown, which is we're into our fourth day now, I imagine there'll be another downward drop in that graph. As I mentioned, there has been a slow uptake in vaccinations up until just recently with this Delta variant being released. There's a lot more people trying to get their vaccinations now. And the last thing I wanted to talk about was industry response. So the government message to pull together and be kind has been well received, and industry has responded to that. There's a lot of protocols for conducting business at different alert levels and have adapted to the new virtual world. There's been some downsizing, of course. And this graph here is kind of showing this is over the last 20 years or so, looking at jobs, annual percentage change. You'll see this in the middle, there's a dip where the global financial crisis happened. On the right-hand side, you'll see the decline, which was since the pandemic, came about. But you will see there is an uptick at the end of that, which is showing there is an increase in as employers are looking to ramp up to meet the demand for infrastructure and housing. And I guess that's the closing point, that cross-discipline skills are becoming more important. That is to an individual and a business level both. And so with that, I wanted to thank you for your time. Thank you.
Thank you very much, Mr. Ladbrook. Now, we would like to proceed to panel discussion. Today, we invite the panelists online, and Dr. Ishiwatari will facilitate this panel discussion. And again, if you have question and comment, please post it on Slido, which is on online Q&A page from this URL. So, Dr. Ishiwatari, could you start the panel discussion?
Thank you very much. Thank you, Inoue-san. So all panelists, would you unmute and the slides, video, could you turn on? Paudel-san, Ladbrook-san, Ting-Chi-san, Khamarrul-san, Tda-san, あれ誰かいない。Yes, thank you. Yeah, all panelists here. Thank you very much. Yes, thank you. Very informative and interesting presentation. We know all countries are struggling to respond to the COVID-19 pandemic and affecting many areas, including disaster response and recovery. 各国から非常に貴重な情報をいただきました。どの国も非常に苦労されているというのが分かっております。So we have received many questions and comments, and I'd like to pick up. First one is, do you think your countries are preparing for the worst case scenario or large disaster, large scale disaster under this pandemic, like a floods or earthquake at capital city? Under this pandemic situation, do you think your countries are ready, or not ready, prepared for such a large-scale disaster? 今、大規模災害が起きたときに各国備えはどうなっているのかということで質問してみたいと思います。Any volunteers to respond to? Any country want to say?
I can speak for New Zealand in that we have a very small population and a small number of people who are in civil defence. I'm involved with civil defence, and it's a growing concern about how we would resource anything else that would happen. We've obviously got an alpine fault that's imminent, sometime in the next, probably most people's lifetime. And if that was to happen during a pandemic, would be a significant problem. We've had recent floods just in one or two areas, and that has been difficult. And so anything more significant would be very, very challenging for a small population to manage.
Yeah, thank you very much. ニュージーランドからも非常に洪水、そういった対応について非常に厳しい状況にあるということを伺いました。二正面作戦といいますか、COVID も対応しながら他の災害に対応するというのは非常に難しいと。Very difficult to manage dual disasters, natural disaster and pandemic. Any other countries want to say?
Yeah, インドから。
Yes, お願いします。
よろしくお願いします。in our country, in the last, of course, seasonally, other than COVID, we have faced earthquake in our northeast part, but which there was not having much damage on that. It was about 100 kilometers away from the main city, Guwahati. So some building damages were there, but which are not that much. And then we have faced several cyclones, which you call typhoon. And of course, we have drastically reduced because of our very, very improved preparedness for the last 20 years. After 1999 super cyclone, India has got a very strong network of cyclone-related early warning, evacuation, and cyclone shelter. So in the last 20 years, when same amount of cyclone has killed more than 1 million, rather I would say, Ichiman, more than 10,000 people die, but now it is hardly 20 or 30 number of deaths. So in the last 20 years, every year there are 2-3 cyclones are there, but they are very strong cyclone. Of course, there are property damages are there, which we are now looking into to reduce the property damage, because we have achieved a lot, especially about the cyclone, to disseminate warning information and also to disseminate, to take the people into the shelter so that life depth has come down less than 100. So this is in case of cyclone, but urban flood, yes, they are happening. Damages are heavy, but now a number of efforts are being made to make our urban life as well as especially urban flood reduction in the damages. Now various measures are being taken up.
Okay. Yeah, thank you very much. I understand last year's cyclone Amphan hit Kolkata and were managed.
Yeah, my Umareta toko desu.
Your hometown. 去年、アンファンってスーパーサイクロンがコルカタを襲いましたが、100名、数十名の死者だった、犠牲者、以前に比べると随分改善されたという話聞いてます。But I think there are some remaining issues to manage spreading COVID-19 in Kolkata. Still, it's challenging.
It is a challenge. It is a challenge. Even now, also cyclone Yash, just Nikagetsukan my cyclone Yash, but it didn't have much damage. But water surge, storm, that cyclone, there is a lot of salt water surge came inside 50-60 kilometer inside inland. So Sundarban, which is climatically very much sensitive area. So a lot of area is under salt water, which is now government has taken up stretch-wise to put levee or bond embankment. So they now project have started to not to allow this storm water to come inside. So various projects are taken up now.
Thank you. インドでは都市洪水対策ですとか高潮対策が進められているということです。Thank you. Yeah, from Nepal.
Yeah, thank you. Thank you so much. Yeah. Other than COVID, we have the big issues or problem related with the earthquake. And also every year we have a landslide and flood as well. So however, the COVID situations also going a little bit in the lower side, but we a lot of learn from the 2015 Gorkha earthquake regarding the preparedness for the disaster risk management issue as well. Yes, after that, government set up the National Disaster Risk Reduction and Management Authority. And yes, governments prepared indoors in 2017, the Act. And institutions set up work from 2019. So now the system is now, I think, the streamlined from the government is taking the lead, not in the ad hoc basis, but in the formalized and the systematic basis. So however, we need to improve a lot, and we need to, because we are in the multi-hazard prone countries, so we need to deal, we need to prepare, we need to document it, all the what we have learned from every year, the disaster. So that has been going on. Recently in the Melamchi area, the Melamchi water supply system now shut down so big because of the huge landslide and flood in that Melamchi river. So yes, we can't say we are prepared, but things is improving based on the discussions with the international agency, and we have been working on in that case. Thank you.
Yeah, thank you. ネパールでも、ゴルカ地震の後、防災庁ができたり、法律が整備されたりということがあって、改善はされてきているということですが、ただ、最近もメラムチというところで地滑りがあって、首都圏への水供給が止まったりというような災害が引き続き起きている、厳しい状況にあるということです。Taiwan and Malaysia, I think your system are quite working well, in particular evacuation shelter. Do you think these systems are working for larger scale disasters? What do you think?
Yeah, let me at the Ishawatari Sensei, thank you for your time and questions. Well, on behalf of Malaysian's counterpart, I think they are making a good progress. In fact, the federal government and the local governments now work hand to hand. And this COVID-19 pandemic, turned them, they put more effort on the culture of preventive into the process and how they can work cross agency, vertically and horizontally. So talking about the impact, yes, we always prepared for the worst, but this time around, I think this coming monsoon, starting in November, there's assumes the impact will be larger than what we are expecting, given the fact that the numbers of positive cases also higher. But a part of the natural hazard, Ishawatari Sensei, I would like to address about there's a growing concern about this NATAC, natural and technological disaster. And we have seen these industrial zones making, coming back to these business activities. So they increase the productions, and perhaps we have to put some effort into these natural and technological disaster or hazard into the place. So these some additional remarks are part of the flooding, landsliding that we face every year. Thank you.
Yeah, okay, thank you. Khamarrul Sensei, you explained managing evacuation shelter and try to manage spreading COVID-19 as a center. And your report says currently it's okay so far. But how do you think if you receive, as you mentioned, the disaster scale is increasing, still local governments can manage or respond to dual disasters, pandemic and
understand the questions.
Yeah.
If I can add, this coming monsoon, there are a series of meetings at the national level and state level. But on top of this preparedness level, there is also a growing effort by the NGOs, civil society, as supplement support to the government assistance. And we also seen there is also a strong groups providing a data from the academic world so that they can make right or quick decisions based on evidence, based on data. So I've seen this a positive way. As you mentioned, last year we reported 0 cases out of 125,000 displaced people, but this time around we are facing 20,000, 5 times than what we faced last year. So I hope that now we are in the mode of preparedness, higher level, but hopefully we can have at least two disaster at the same time. If we have 3 or 4 disaster occur at the same time, then we need more simulation or effort to cope these challenges. Ishawatari Sensei.
Yeah, thank you very much. マレーシアでもいろいろな組織が共同して、災害対応しているということです。災害、自然災害とテクノロジーの災害とかの複合災害の恐れもありますということです。COVID に関しては、NGO なども協力も得ながら、政府と一緒に、対応をしているというところだそうです。Ting-Chi 先生、yeah, same question. Taiwan looks like a very well managing COVID and disaster also. How do you expect larger scale disasters?
Yes, we try to learn from history. So 12 years ago, there was a typhoon visit Taiwan and bring like 3,000 millimeters of rainfall in 3 days. And that in that disaster, that there was a landslide, killed nearly 500 people in the village. And after that, the government has been prepared for the future extreme precipitation or extreme weathers. So we learned from the lessons that we have to prepare in advance. And after 12 years, and it was last early August, about a month ago, there was another typhoon visited Taiwan. And in the nearly same region, the rainfall was about half of the historical rainfall event, which in this August, it was like 1,500 millimeters in 3 days. But this time, there were no casualties. There were no one was killed in the rainfall or debris or landslide event. And I think we learned from the history. This is very important. And but we also have to prepare for the unprepared. That is the difficult part. And so I believe that it is very important through this TC21 collaborations that we learn from other countries around the world or in the Asian region, that we can imagine that what may be in front of us, waiting for us in the future. So from today's several talks, we've learned a lot, and that the way that other countries manage disasters in different situations, and many interesting suggestions. For example, from our colleagues from New Zealand, now I know that if I have extra money, I should buy new houses because the house will rise very much. So thank you. Yeah, so I think that learn from other countries and prepare the unprepared. Thank you.
Thank you very much. Yeah, very good comments for our activities. Thank you so much. Yes, 台湾でも災害がひどくなるのと同時にいろいろ対応は進めてきてますが、予期できないこういうコロナ禍での対応、これはやっぱり各国の事例を学んでいく必要があるだろうと、まさにこの TC21 の活動もこういう、まだ我々何すればいいかよくわからないというところで各国の事例を学ぶというのは非常に大事かと思っております。荒木田さんのところに質問が来てて、荒木田さんが日本を代表しているわけじゃないんですが、各国のこういった事例を、日本は学んでるのでしょうかというとちょっと言葉きつくなっちゃいますが、こういう学ぶ機会を持ってそういう政策にとかですね、生かそうとしているのか、ご存知の範囲でお答えいただければと思います。そうか。Yeah, same question for Arakida-san. And yeah, one question is Japan is learning from other countries. Well, so Arakida-san.
Yeah. Thank you for the question. As I mentioned, even in Japan, local government and ministries and private company are preparing for guideline for response in pandemic. And also ADRC have an annual meeting for member countries in Asia, including Japan. The focal point of Japan is cabinet office. So we exchange and learn each other for our good experience. And we hope we can find a better future in each other. Especially in Japan, main topic is a Nankai big earthquake. It is expected to occur within a percentage of 70 to 80 within 30 years. The magnitude is 8 to 9. So it will bring a big shake and tsunami. So we need to concentrate mainstreaming of DRR more and more. So we need any experiences and knowledge for building a safer society.
from the world. Thank you.
はい、ありがとうございます。まさに荒木田さんのおられるアジア防災センター、そういうアジアの各国の情報が集まる、そういうプラットフォームになっておりますので、そういう機能、まさにこういう時だからこそ、期待したいと思います。いろいろな情報を集めていただければと思います。はい。And actually, we received various questions, but I think crucial keywords is ICT and trust to manage COVID-19. ICT, yeah, we already saw like a QR code or apps or smartphones at Taiwan or other countries. Yeah, so ICT is definitely useful, but yeah, and the Nepal case is also good cases. But at the same time, we may have some inequality or digital divide. Yeah, someone may left behind from this. So this is one question. And second question is a trust. One question is New Zealand government sounds like trusted by the public. Well, I'm not. I don't want to comment on Japanese people's trust, but so another keyword would be a trust. So these would be two measures to manage COVID-19. So I'm sorry, we don't have enough time. One or two comments from panelists. First, New Zealand. Why New Zealand government is trusted? Well, silly question. So
yeah. Well, that's a big question, and I think that some of those things are due to the culture, being a small island nation, where we come together when there's adversity. We come together in sport. We come together for causes, whether it's the America's Cup or the rugby or the Olympics or if there's been any disasters, we do also come together. There's not so many of us, so when we are in need of help, we tend to help each other. And so the government has generally been upfront about things, and that's a good thing. It's not always been that way. There's been times when different governments have been mistrusted, but I think that the current government has been very vocal. They've been in front of the people on the news almost every day about these matters. And so people feel like they are doing something. When the government doesn't say anything, then people start to wonder and they think the government's not doing anything. So by being very engaging with using the media, people have a high level of confidence. I'm not sure if that's going to be true over a long period of time, but for short duration events, people will put up with the disadvantages and trouble. Over longer term, I'm not sure if that's true.
Thank you very much. 文化的なものがあるんではないかと、お互い助け合う災害の時とか、そういうカルチャー、一緒に何か、向かっていくというカルチャーがあるんじゃないかということです。この辺はお国からの違いなのかもしれないです。もう一つ ICT にちょっと伺いたいと思うんですが、I believe Taiwan is a leading in this area using ICT for managing COVID-19. So how the country is trying to resolve such a divide, like elderlies may not use smartphone, or some rural people, you mentioned mountain people cannot access information. How do you resolve such an inequality? Would you explain?
Yeah, okay. For the QR code system, it is actually before the introduction of the QR code system by the government, a local government or some, for example, 7-Elevens, they have their own systems, which is basically the same. You scan something and then you input your names, your phone numbers, and send it to the database of for example, the 7-Eleven stores. but that system is difficult to apply to all other stores and or even like schools or something. And some of those systems require a Wi-Fi connection rather than just a regular phone connections. So not all of the cell phones they have a limited Wi-Fi access. So that so the government when they planning a new system to replace the others, they did consider that many elder people, they do not have a limited access to Wi-Fi's, or they have difficulties to use computers at home. So they still have a paper-based registration system, and also for those old-fashioned cell phones, the 2G or 3Gs. And if you can send a text message, you can still do it the same way, but it will take from like 5 seconds to like 20 to 30 seconds. So everyone is still accessible to the stores which require the customers to register at the door. And also that for the people in the mountain regions or have limited access to the internet, they also utilize the post office or local government offices, and even police stations and other facilities that can provide assistance or helps for registration for ordering like a facial medical mask, or to register the vaccines in online. They send the village heads to help people that there were no internet access or have difficulty to access. So the government has been doing these to help those have minorities. And I think one important thing is that since the breakout of the COVID-19, the government in Taiwan, they held daily real-time news release every day. So, and it is open to the journalists or the TV station to ask questions, and it was broadcast live, so that the people could see by themselves on the TV that how the government answer all these questions, and how do they pre-plan or they announce information in the live broadcast. So I think that is a good way to increase the trust from the people to the government. Thank you.
Thank you. Thank you very much. 台湾からは一つは、特定の店で始まったシステムでもそれを展開していったり、古いスマホを持っていてもそれでもアクセス情報をくれたり、またペーパー、紙でのやり取りもできるということです。地方部では、自治体とか村長さんがそういうケアをしてくれていると。また政府は毎日ニュースリリース、新聞発表ですかね、して記者発表をして情報の公開に努めて、それが国民の信頼を作るようにつなげているということです。Thank you very much. もう時間ですかね。I'm sorry, time is running out, but I believe we have a very good discussion, and definitely we need to continue such a discussion. I hope we can continue to collaborate, such exchanging our knowledge and experience. I believe it's a very useful. 非常に有益なご意見いただきましてありがとうございます。またこういう非常に大事な機会ですので、また続けてこういう機会を TC21 も作っていけたらと思っております。そうしましたらまとめも含めて竹内先生にお願いしたいと思いますので、パネルディスカッションはこれで終わりたいと思います。Thank you very much indeed. Thank you for your cooperation and good discussion.
Thank you. Thank you so much.
Thank you.
Thank you very much to all panelists for fruitful discussion. Now we are here in the closing remarks from Professor Kuniyoshi Takeuchi, the Emeritus Professor at the University of Yamanashi and the former co-chair at the TC21. So please welcome Professor Kuniyoshi Takeuchi. では、竹内先生、マイクを、はい、オンにしていただいて、すみません、ちょっと巻き気味でよろしくお願いします。
はい。Well, thank you very much for your very informative presentation. We learned quite many things from various countries, and the last the panel discussion was also very nice. Well, today's theme was how COVID-19 affected the transdisciplinary approach and decision-making on building disaster resilience. And I was quite much interested in whether the TDA has been promoted by, how promoted in various countries by this COVID. And we witnessed it is really the TDA promotion affected. And the reason was, I think, basically two of them. One is the under COVID-19 or this kind of disaster, we need to have collaboration, the working together. And this is kind of because of necessity, lots of people working together. And this was really realized. And somebody was saying the under disaster, the collaboration is promoted because, and we call it so-called disaster utopia. You know, disaster, people becomes very helpful each other and mutually work together. And the intra-governmental intra-governmental sectors and also together with communities and NGOs working together. This is because of necessity, and this is wisdom of human being. And the other thing is the virtual technology. And virtual technology promoted the TDA because it makes the working together easy. And because of this, the internet, we don't have to go to travel. And even the people who cannot move or maybe who is not, who cannot pay the airplane, we can communicate. So the people can work together. This is the technology supported. And also by this, it is obvious who is disclosing information or not. So information disclosure is also promoted. Well, yeah. Okay. So I think this we found the COVID-19 promoted the TDA quite well, and the TC21 has to find it out how it is progressing in various countries, and we may come up with the guidelines for TDA. Well, thank you very much.
Thank you very much, Professor Takeuchi. And now we'd like to close this session by thanking all the presenters and attendants. Again, please give a big hand to today's presenters. So that's all for today's session. Thank you very much. See you again.